Hey guys, how you doing? This is Dr. Mike of iCAN Clinic. So we've been getting a lot of questions on how frequently do you adjust children, or when do you get kids adjusted and different things like that. And then also, how is a child adjusted? A lot of people tend to believe that the child is adjusted the same way as an adult, and that is far from the truth, okay? So when do you want to get a child adjusted, or when should they get checked and different things like that? Usually it's not a bad idea to maybe once a month, once every other month, have your child checked. Now, if the child though is going through different phases of growing up, as far as when they're teething, it's really common up here in the upper cervicals to have those subluxated. Or if they're having ear infections, a lot of times these upper cervicals are out of alignment, and those can actually start to affect the eustachian tube and different things coming down from the ear. So an adjustment here can actually start to allow that lymphatic drainage and calm down the nerves that are irritated as well from the teething or from an ear infection, different things like that. So we see a lot of good results with ear infections and teething with just adjusting the upper neck. Now when we do adjust the upper neck, it's a very simple and it's just slight pressure, okay? It's not a big rotation, it's nothing like that. He was out a little bit on this right side on C1. And then too, when the child starts to walk or learning to walk, different things like that, we start to see a lot of, because they're falling on their bottom, different things like that. So we start to see a lot of different distortions with the hips. Sometimes too, parents will notice when their child starts to walk or learning to walk, when they start walking, that they'll maybe swing one leg wider or step awkward with one leg. Or even I had one parent, when her daughter's hips were out of alignment and they were locked up, her daughter would actually fall to the right side. And so what we do is we'd have to adjust the hip. So what I'm going to show you is how we adjust the hip, okay? Go put your hands down for me, bud. So with Hewitt here, he's a little bit older. So we can do a little more pressure down here on the hips. There we go, good. Yeah, those are moving nicely. And now to check his lower back, especially if we're having any digestion issues or issues with bowel movements, either constipation or diarrhea, or even colic in the younger babies, we can actually do some adjustments down here in the lower back. Good, good. Yeah, L5 there a little bit. Or here in the middle back, especially for projectile vomiting and different things like that. Good. And with colic too, we can do some abdominal massage and different things like that to break up any adhesions or spasms that is in the intestinal musculature or abdominal musculature that could also be stimulating the colic or the colic reactions. If you have any questions, feel free to give our office a call, 618-254-2273. I hope you guys found this very informative. Thank you and have an awesome day.